You know the feeling. You're logging in for a time-sensitive activity, but you keep botching the password. That's password pain. Now, imagine it in a healthcare setting where access can mean life and death. I'm Joel McConvey, and on today's episode of the Biometric Update Podcast, I talk to ER physician Dr. Sean Kelly, who's also the Chief Medical Officer for Imprivata, about some concerning findings in the company's latest report. Welcome to the podcast, Sean, and thank you again for joining us. It is great to have some healthcare content. The healthcare industry is so huge and so vast, so it's really good to have you here to talk about this issue. I guess I'll start by asking you to give me a sense of the sort of privacy and fraud threats facing the healthcare industry as outlined in Imprivata's new report.
So thanks, Joel. There are a lot of different concerns in healthcare with regard to regulation and privacy and security, of course. So in healthcare, as you might know, we have HIPAA, which is a major privacy law, and we're all bound to be compliant with that. And essentially what it says is we're really supposed to use data only as necessary and needed for proper purposes. So that has to do with patient data. It also has to do with any employee data and other data around it. And so, that's one concern is just privacy regulations. But from a security standpoint, there's a treasure trove of information that's available to hackers in healthcare. And in many cases, it's worse than in other industries, because not only do you find financial and demographic data, which can be useful to hackers for all the obvious reasons, but you also have medical data, which is very private. And once that gets out, there's no taking it back. So that's the kind of thing where if a bank allows a hacker to take money out, they can make that person whole again by returning money to them. But if information gets out of a private nature that affects that individual or even that company that the individual works for or their family, there's no getting that back and the damage is done. And so that is those are big stakes. Also, hospitals and other healthcare providers really can't afford to be taken down for long periods of time. It really does cause morbidity and mortality in addition to financial damages to the healthcare system when facilities have to go off of their digital tools and go on what we call downtime procedures. So the stakes are higher in healthcare, and it's been proven that hackers find that those information more valuable in healthcare, and it's more at risk. At the same time, we have less budget than a lot of other industries. So if you look at the IT spend and security spend in something like the financial industry compared to healthcare, it's markedly less than healthcare. And then there's even more vulnerability the farther out into rural facilities that you go. So what you're left with is a complex environment with a lot of wide attack surface that's quite vulnerable, with some high stakes information that's valuable to hackers and hard to protect in an environment where we don't spend as much because there's not a lot of excess budget in healthcare to do so.
Yeah, I remember working for a hospital. Everything ultimately you're trying to put towards beds. You want people, you want capacity, you want space for people, you want treatment. So IT sometimes gets pushed aside a little bit, and security and these kinds of measures. So let's talk about
those trends are certainly true.
Yeah.
I will say that cybersecurity is a priority for healthcare and IT is a priority. And so, while it's proportionally less than other industries, it still does command budget and spend, and hospital systems and other provider systems know it's important. And of course, they'd like to spend more. They're just limited by the budgets they have. But when they are spending, they're trying to spend in the most intelligent way possible to get the most bang for buck.
And one can assume that both the need for spend and the spend to follow will increase in the coming years as these kind of threats become more pronounced and more things get digitized.
Both correct. I think when you look at market analyses and when you see surveys with digital leadership out there and IT and security leadership, you do see indications that when they prioritize budget, they realize that we have to spend on those things, and we expect that number to go up commensurate with the attacks that are coming in, especially with AI coming online, both for evil as well as good, right? It has a lot of potential in the healthcare industry, but it's easier for hackers to get and use and actually, code with AI and perform these attacks with social engineering and ransomware attacks as well. So we're left with a very vulnerable situation and a complex situation.
In surveying the healthcare sector for Imprivata's new report, what did you find out? What's the sort of state of passwordless authentication in the healthcare sector today?
So the long and the short of it is we know that we're using an antiquated system and framework that relies heavily on passwords, which have been around since the 1960s, and they've gotten longer and more complex, which we understand. They have to, right? Because in order to fight the encryption, the hacker capabilities, you have to make them longer and more difficult to crack. Of course, when you have a 16-character password with special characters and a passphrase, that can be really burdensome to the healthcare industry. And we'll talk a little bit in a minute around how the healthcare industry is a little bit different as far as the complexity of the workforce and the workflows. But certainly, it's an age-old problem where security is trying to make things as locked down and tight as possible. But by creating a system that's very locked down, it prevents doctors and nurses and others from getting in quickly if they're blocked by a long, complex password. They mistype it 3 times and suddenly they're locked out and they're on the phone to the help desk. Well, that's one thing if you're at home in your office waiting to do a podcast. That's stressful enough. But if you're in the ER where I work, and I still work as a doctor there, and someone's rolling in front of you has a stroke, it's literally time dependent and seconds matter. And so you've got this incredible tension between the security aspects, which are completely legitimate, but then the efficiency of care aspects, where you really have to let the people who are really doing their jobs, let them get in to do their jobs and be doctors and nurses and other workers in healthcare. So there's always been this tension. Passwords have been that tried and true way that many places lean upon. But as we move along, everyone realizes that this isn't the way forward, that we need to modernize and use more effective technology so that the end users can get in faster and more easily, but we keep the bad actors out. And certainly going more passwordless is a way to do that. When you start to roll in other authentication modalities like biometrics or passkeys, and you're really talking about multi-factor authentication, that gets to be a really effective way to do things as long as it's good technology and as long as it doesn't block the people who need to get in quickly from getting fast access. Now, you and I know, and your audience knows, there are ways to do that. And that's where good technology wins out. But healthcare has had a lot of bad technology. We've been burned a lot of times. And so there's a bit of a resistance to deploying new technology because we've been sold a bill of goods a lot, right? Like, here's this new system that's going to make your life a lot easier. It gets put in, and guess what? It's not completely optimized for clinical care, and it makes things difficult. And then improvements get made, and slowly it improves. But we've learned that in the past as practicing doctors and nurses to be somewhat suspicious of technology, particularly security-based solutions, and make sure that they're actually usable. So, the long and the short of it, when you look at the study that we're putting out and the questionnaires that we had, is that almost every place, like 85% of respondents say this is a critical path forward. We need to go more passwordless, but only 7% have actually done it. And honestly, Joel, I don't think that 7% is completely passwordless. They may have a password in the background still, and that's perfectly legitimate because sometimes when you're out of band, you sort of need that one last fail-safe way to get back in. But if it's out there, it can be found out. And if it's there, it can be used to hack in and get an attack. So you see a big gap is the summary between what we want to do and where we're at operationally.
So it sounds like there's so many factors at play here. You've got time. There really isn't ever an industry in which time is more critical than healthcare. And then you've got the culture of the kind of institutional culture of healthcare, which is a little wary of new technology. And I wonder if I can ask, you seem like a rarity yourself in that you're a practicing physician who also knows the ins and outs of the uh, passwordless authentication world. Are there others like you who are on this mission?
Yeah, I'm certainly tech curious, and know enough to be dangerous. There are more and more clinicians and other workers in healthcare who are appreciative of technology. I think the way to try to think about it is that in healthcare, most of us don't care about technology for technology's sake. Technology is just another means to an ends, and the ends is always what we signed up for. Just let me care for my patient. Let me perform medicine. Let me talk to patients and do procedures and deliver care. And technology is a tool like many others, right? It's like a stethoscope, but potentially even better and more powerful when it's used correctly. Security technology needs to be as invisible as possible and as seamless as possible. And so traditionally, there's been this battle between the security aspects and then the efficiency and productivity aspects. And traditionally, you think of forcing a choice, one versus the other, like it's a zero sum game or a balancing act. But I think good technology, and biometrics is a great example, can actually deliver more of both. And I think that's the paradigm shift that a lot of us on the front lines are looking for. Make the right thing to do actually easier for me to do. And a biometrics is a good example. If I simply walk up and it sees my face in the proper circumstance and lets me in, but it doesn't let anyone else in, well, that's a win-win, right? That is better for me faster than a password that I might forget and give up and cause a ransomware attack. And it's actually better for my speed and efficiency. I don't even have to touch that keyboard. And in healthcare, there may be lots of times when I'm doing that. I might be looking up and trying to look at an X-ray or a fluoroscopy, like an in-room exam, while I'm actually performing something, and I may have gloves on or be sterile. So there are a lot of use cases where biometrics can be a really elegant solution. Now, there are a lot of caveats to that, as you and your audience know. Any good solution needs to obtain and store those under the right circumstances. As I said, in healthcare, we're particularly sensitive to that. There are several states that have regulations that are specific to biometrics. Of course, everyone needs to consent for them. And just like with HIPAA, they can only be used for the stated purpose. Try to limit the purpose as much as possible so that you're limiting the usage of those to the proper usage. So, but even with those caveats, I think more and more people are getting conditioned to the value of biometrics and other modalities. When you think about all of us out there, whether we're going through airports or we're using it on our phone, we're getting so much more familiar with the modality. And at the same time, the available software and hardware just keeps improving. And it's to the point now where your standard issue webcams and your standard issue phones are all perfectly capable of doing real time biometrics at scale and delivering, if done properly with the software, liveness detection and encryption in flight, encryption at rest. And that now has hit a tipping point where I think the market's more conditioned to it. The technology's actually improved. The use cases are pretty refined. And so we're seeing a big area of growth here. Quite frankly, we're seeing like the modernization of identity and access management in healthcare. It's not a linear phenomenon right now. It went from being very slow and very difficult to adopt to suddenly Imprivata and other companies are really putting top-notch solutions into the market that are getting adopted, and we see a bright future with it.
I have to imagine that at least on the clinician side, some of the privacy concerns you might get with biometrics in, say, a retail setting or something else don't really come into play either. I mean, the hospital knows who you are. Everyone has to register with a badge or whatnot. So, is there Does that factor in at all, or is it there an understanding that, like, we as clinicians, our identity is out there for the hospital anyhow, and so we're fine. We're more amenable to the idea of giving biometrics and using biometric systems.
It's a great question. Yes and no. So there will always be a small percentage of the population that might resist biometrics or other methods. I think more and more of the population is recognizing how important it can be and how effective it can be. A lot of the mindset in healthcare, like in many other verticals, has to do with benefit versus risk. And if the benefits far outweigh the risks, then you'll see more and more people using it. And there may always be a small percentage that don't. But I definitely see the trend as more and more recognize the benefit and are willing to use it, especially since they're using it in so many other places in their lives. And then I think the other thing to think through is that workflows are extremely important. And so beyond just an individual, like an employee's willingness to use it, when and how and where is it used is incredibly important. And not every authentication event is equal. So if I'm in a protected area of the hospital where I've already badged in and I've already logged in and I'm using the same computer I'm always using, and I'm acting in a way that is similar to how I'm always acting, do you really need a two-factor authentication for me to get into my usual place of work, the EHR like Epic or others? Probably not, right? But if suddenly you take that same experience of trying to log into the electronic health record and I'm logging in from China, it might be legitimate. Like I visit other countries and sometimes I need to go in and look things up, but that's a high risk authentication event. And now you need to invoke a multi-factor authentication or even block it if you can do risk signaling in the background to understand that this is an impossible traveler situation, or it's coming from a known bad URL or website or location. And so putting some risk signaling in and coming up with that zero tolerance policy is actually really important. And we've always had a Goldilocks problem where we've seemed to always have too much or too little security. It's hard to make it fit just right. But modern solutions like ours, actually, we build in threat detection, we build in risk-based analytics so that it's easier for those that are doing what they normally do in ways in protected areas that are less risk, but harder with more factors if there's aberrant behavior. And biometrics, we think, are one of the most important ingredients to do all that and make it work. Because, as we said, it's easier, but it's also highly effective.
In terms of what's being used or what people are interested in, how do the modalities break down? I have to imagine mostly we're talking about face biometrics when we're talking about instant access, but there are other modalities out there that have use cases.
I would say facial is the area of biggest interest right now. We have some fingerprint usage out there. We've had that specifically because there were some states where fingerprint was required before facial was available for orders. For example, the Ohio Board of Pharmacy required biometrics, and fingerprint was the best and most available when that happened years ago. And fingerprints are a reasonable option, although, of course, it does require a fingerprint reader. And unlike cameras that are used for multiple different things, the fingerprint reader really is just for that biometric, whereas facial biometrics leverage a camera, which is obviously used for multiple different things. And in healthcare, we see cameras being put in for other things like virtual sitters and virtual nursing. Artificial intelligence looking at workflows within an OR to see if things are efficiently being moved in and out or when that room's ready for telehealth visits and for on phones in general. You can even use them now to do barcode scanning for patients for med administration. So we see it as a really attractive option, both because people are more and more used to it, but also you can leverage that same hardware, the camera and the software, for multiple other things. And so circling back to the initial part of our conversation where we talked about healthcare systems not having a lot of budget. Well, if you're going to spend, you might as well spend on something that enhances security, but also productivity and efficiency. Our solutions do that. And when we leverage cameras with facial biometrics, those same cameras can be leveraged for all the other things we just talked about, and potentially even get rid of other endpoints because the phone is so effective and you can carry it around in different places. So suddenly you're talking about not just improving efficiency, productivity, and usability, and then security and compliance, like we talked about, but you're adding in another third pillar, which is the financial consideration. You're doing more with less.
Is there a use case on the patient side for this stuff as well, or is this strictly kind of enterprise institutional, a use case that we're looking at?
Great question. Absolutely. We actually have a technology right now that's facial recognition of patients that's used to help prevent misidentification. So misidentification in healthcare is still a big problem. Right now, we rely heavily in healthcare on human beings to ask someone's identity, maybe look at a driver's license if they have it. But if there's cultural differences or language differences, or someone's hard of hearing or confused or in distress, we often don't even get that information. And even when we do, we might fat finger things in there, or someone's date might be transposed. Different cultures have different ways of recording birth dates and names. And inadvertent error can happen, as well as fraud. And the patient matching software is certainly getting better, but it's nowhere close to perfect. So we think there's still a mismatch rate of 10%, even in best case scenarios. And sometimes between systems, it can go up around 30%, which is horrifying when you think about it. If you think of your bank, if your bank only got your deposit into your account 9 out of 10 times, I don't think you'd be with that bank anymore. And this is even more dangerous, because if I don't know you have an allergy to penicillin, there's a 1 in 10,000 chance I can give you anaphylaxis and lead to death, or a massive allergic reaction, by giving you that medicine. And that's something that should be available to me, but by any kind of error or mistake, I can't get it because there's misidentification. Big problems. The patient safety issues are huge. The financial issues are huge. So just getting that data right on the outset upon registration or even pre-registration, it really is priceless in healthcare. So facial biometrics can do that. So virtually 100% accurate way to match someone to their records. So that's a very powerful system. We used to have one that used a palm vein biometric, but we think facial, for all the reasons we talked about above, is a better, more modern, more standardly available modality. And we are now rolling that out with some success, and we see more growth in that area.
It's really tough to beat the convenience of the phone and the camera, ubiquity of the camera there. Yeah. And face biometrics is so natural now with selfies and whatnot. So It does make sense. I want to ask you about the future a little bit. Things are transforming everywhere. Based on what you learned in this report, in this survey, where do you see the healthcare sector going in the next, say, 3 years in terms of its journey towards passwordlessness?
So we think there will be a lot of progress in passwordless in the near future. As we talked about, there are significant forces in play that are increasing the risk of not doing anything. And the needs are so great, and the public is now more and more conditioned to using modalities like face. And the systems have gotten so good that I think that this is going to happen, and going to happen quite rapidly. We all in our private lives experience the need to do two-factor authentication, but just using a token and just having a one-size-fits-all tool, it just doesn't work. As we talked about, it's usually too little or too much security. And as more and more ransomware attacks happen, good biometrics can help prevent a lot of that. Now, they have to be good systems. You have to have liveness detection. They have to prevent spoofing. And a lot of your audience probably knows a lot more about that than I do. But in healthcare, we are really we are really concentrating on technology that works and technology that actually improves our workflow and allows us to take better care of patients. And we see early signals that many hospital systems really want to move towards passwordless if they can. It's a journey and it might take several years, as you said. But I think at least for the first step, using more and more things like biometrics or pass keys and having a password that's long and complex in the background is an okay intermediate step that's realistic. And at least then, most of those digital events are protected. And yes, there's still vulnerability with having a password somewhere in the background, but it could even be masked to the end user. We do that with our privileged access management, where we have passwords in the background because some of the apps still need them to function properly, but the user actually never knows them. And you can make them temporary and time-based, and you can anchor that all on a good biometric or several other factors at once. And I do think that workflow orchestration and a multifactorial approach is key. And that's what I see happening, is that as healthcare systems adopt facial biometrics and mix that into the system, they'll realize they now have multiple options. There is a password there they can use less and less, but they can now start to use more facial biometrics and pass keys and tokens. And in each different workflow could have whatever's most appropriate according to what that person is properly enrolled in and what's available on that particular endpoint. And then the last linchpin of it all is that risk-based analytics in the background to do risk signaling to determine when you do step-up authentication versus let someone write in. So I guess in summary, we see it changing. There will always be early adopters and late adopters, but there's such a need for multifactorial authentication that we see almost every place making a move towards that. Many will just think of that as a token, but the rest of the market hopefully will start to realize facial biometrics and others being mixed into it with workflow orchestration is a leap that they can make now, and it's very effective.
Yeah, a lot of potential, certainly. Well, it's been fascinating to chat with you, and I thank you again for sharing your knowledge and your expertise.
Thanks, Joel. It was fun.
Thanks again to Dr. Sean Kelly from Imprivata for joining us. You can find the company at imprivata.com. And thanks to you for listening. You can always keep up with the world's journey away from passwords at www.biometricupdate.com.